we're going to wrap things up here talking about the health impacts of the cardiovascular system. A healthy cardiovascular system is very important for you. And in fact, heart disease is one of the leading causes of death in the United States. So there's lots that you can do in order to keep your heart and your blood vessels healthy, which will help keep you healthy. So here we go. First thing is pulse. I'm sure all of you have heard of this before. Maybe you've even taken your own pulse. What your pulse is the arteries, as the heart is contracting and pushing blood through them, the pressure inside those arteries goes up and the artery itself expands. And then as your heart is relaxing in between beats, that artery kind of contracts back down, and then it beats again, it expands. So you can feel that pulsing, which is where the term pulse comes from, in your arteries. So often you can check it on your wrist, and counting the number of beats per minute will give you your pulse rate. And that is an overall indicator of your cardiovascular health. If your heart has to beat more when at rest, it will beat more when you're doing activity, because your body needs more energy, more oxygen. So your heart beats faster in order to keep up with that. But when you're at rest, if your heart is having to work extremely hard just to keep your cells happy and supplied, that's an indicator that maybe your cardiovascular system is not working as efficiently as it should. And we'll talk about some general things that you can do to help promote a healthy cardiovascular system. Different places that you can feel your pulse throughout your body. Like I said, you've got your wrist, your carotid artery in your neck. You've got on the side of your head, your arm, your groin, and knee and foot are some common places that you can feel your pulse. Blood pressure related to pulse. Like I was saying, when your heart contracts, the pressure inside the arteries goes up because blood is being pushed through it. And we can measure the pressure inside of your arteries, and we call that your blood pressure. You have two blood pressure numbers. If you've ever gone to the doctor's office, or like that little inflatey arm thing at like Walmart or something, you sit in it and it goes, it inflates.
The scary arm trap.
The scary arm trap, right? As a kid, you're like, this looks like fun, and then your arm is stuck, and you're like, Mom. Okay, just bringing back terrible memories. Thanks, you get two numbers. The scary arm machine gives you two numbers, your systolic and your diastolic. Really, they correspond to when is your heart actively contracting. The pressure is higher when the heart is squeezing the blood through. And then in between beats, when your heart is relaxed, the pressure goes down, and that's your diastolic. So a healthy blood pressure is usually given as 120/80. The millimeters of mercury are the units on that one there. We usually just say 120/80. Recent health guidelines have even kind of bumped that down a little bit lower than that. So, you know, you as young teenagers probably have a healthy blood pressure somewhere in like the low, like 110/70 or something like that. But blood pressure is one of those things, as you get older, you're going to watch closer and closer and closer. Because again, it's an overall indicator of how hard is your heart having to work and how healthy is your cardiovascular system.
And so one thing you might have heard of, or will maybe in the future hear of, hopefully
right.
not, is having high blood pressure, right? Or sometimes called hypertension. And so if you have a higher number than kind of what we showed on the last slide, that 120/80, it means that your heart is working harder, right? That's a measure of how much kind of force is being exerted on your blood vessels. So if it's a higher number, there's more pushing on your blood vessels. So it's not a good thing for your body. It means your heart is working harder, and it can potentially damage your heart, your blood vessels. It's not a good thing. So ways you can kind of prevent getting high blood pressure, kind of diet and exercise, right? That's usually kind of what you have to look at for many health things. So reducing salt, eating those fruits and vegetables regularly, avoiding fats, not smoking, drinking, things like that, and just being physically active are ways to hopefully avoid having that high blood pressure. Other issues you can run into are artery disease or arteriosclerosis. I can say that one. Arteries become narrowed and hardened, right? We said basically arteries, we said, are a little bit smaller, like diameter. They have the really thick walls. Well, if you have kind of a buildup of stuff even within that, so buildup of fats in your arteries, they're going to get even smaller, right? And so this could potentially lead to your blood kind of getting clogged, right? If there's not enough room for this blood to kind of flow through there, it's going to lead to some issues as well. Some things to avoid kind of getting that buildup in your arteries. Again, diet, activity, things like that. So having a diet low in saturated fat, exercising, reducing salt. Again, it has high blood pressure here is another kind of factor in this as well. Not smoking, things like that as well. So you can start to see a common theme in things that are good for your cardiovascular health. And finally, heart attacks, right? So the coronary artery, remember those were the ones we talked about. Those are the arteries that are bringing blood to your heart. They're supplying your heart with the nutrients and things it needs. So you get on the outside of the heart there. And the heart tissue can't get oxygen and nutrients, and cells are starting to die, which is a very bad thing, right? If the arteries that are bringing the nutrients to your heart, which is bringing the nutrients to all the rest of your cells, it's not good if that starts to fail and is not able to carry out its function. So this, again, we have a buildup of kind of fats and clots and things that are preventing oxygen from moving through those blood vessels. And so your heart is unable to carry out its function, and that means the rest of your cardiovascular system is going to be shut down as well.
All right. So how can you tell if you're having a heart attack, or if somebody that you are with or you see is having a heart attack? Well, there's the classic signs that you see in all, the movies or TV. If they want to show that somebody's having a heart attack, they'll do this. They feel like the tightness or pain in the chest, or radiating.
I thought you were just flexing. You're like,
I wish. No, but tightness in the chest, or pain in the left shoulder and arm. And really, it's the inside of the arm here, not the outside of the arm, believe it or not. So it's not the whole arm, it's just here. And then the shoulder and chest. So you get that pain. Now, that's not because there's something wrong here in your arm or your chest. And you're not actually feeling your heart. It feels like your chest. It doesn't feel deep in your heart, because your heart doesn't have pain sensors in the brain. So what's happening there is it's what's called referred pain, where your body will take some pain on an internal organ and it will project it somewhere else. So you feel that pain here instead of in the heart, because you can't actually feel pain itself in the heart. You also have a shortness of breath, because your heart's not pumping as efficiently. If we got cells that are dying, or dead, depending on how severe the heart attack is. So you'll be shortness of breath as you're trying to get more oxygen. Even though your lungs are working fine, your heart's not getting it where it needs to go. And those stress hormones are getting released when you're going through a heart attack will also cause anxiety. So you'll get a sense of doom and anxiety. Some other these happen for folks all the time. The top three are the most common symptoms, particularly in men. We'll talk about symptoms in women in a little bit. But things like prolonged pain in the upper abdomen, intense sweating, like all of a sudden you just start pouring off sweat for no reason, because your body is working hard, your heart's working hard, even though you're just sitting there, okay? The impending sense of doom, fainting, lack of oxygen getting to your brain because your heart's not working well, nausea and vomiting, heartburn or abdominal pain, or some additional signs that are women, clammy skin, lightheadedness or dizziness, also, once again, lack of oxygen to the brain, and just being unexpectedly tired and fatigued. Heart attack symptoms in women. Women suffer from cardiovascular disease and heart attacks as much as men do in this country. Unfortunately, they tend not to seek treatment as early as men. Usually, the stereotype is guys won't go to the doctor, unless they're forced to. But guys, those symptoms that happen in guys are classic heart attack symptoms, and guys think of themselves as being prone to heart attacks. Whereas women's symptoms tend not to be quite the, that's a heart attack only symptom. They tend to be ones that, I could pass it off as this, or I could pass it off as that. A lot of people think women don't suffer heart attacks as much as men. They do. And the problem is they wait too long before they go to the hospital. And the sooner you get treatment, the more likely you are to survive, and more likely to have quick and full recoveries, or recover as much as you can. So Other symptoms you might see in women, kind of a squeezing in the center of your chest, lasts more than a few minutes or goes away and comes back. Pain or comfort in both arms, in the back of the neck, jaw, and stomach. Shortness of breath without chest discomfort. And then we have those other ones we talked about, lightheadedness, cold sweat, nausea. But they don't get as many of the really common symptoms that we think about and we see all the time. So something for you to be aware of for the women in your life. If you think you or somebody else is having a heart attack, the very first thing you should do is call 911 or your local emergency number, okay? And they'll tell you what to do. The other thing is, if you have some aspirin handy, chew and swallow the aspirin. Now you chew it, if you remember back from your 9th grade chemistry, you chew it, that increases the surface area so that it can get broken down and into your bloodstream faster, right? And get to where it needs to go. But what the aspirin is doing is it's a blood thinner. Sometimes people are on aspirin on a regular basis, they get cut and they'll have a harder time stopping the bleeding because aspirin is a blood thinner. And if you're having a heart attack because of blockages in those coronary vessels that supply the heart with blood, if those are blocked, one way to help get blood past the blockage is to get the blood thinner. So that's what aspirin does. If that person has nitroglycerin, they'll put a little pill of that underneath their tongue. If you run across somebody who is unconscious and unresponsive, then you're going to begin CPR immediately and get an AED, artificial defibrillator, if one is handy, and follow those device instructions. But the first thing is call 911. Don't get in the car and drive yourself to the hospital if you think you're having a heart attack, because it can go from bad to worse in a hurry, and then you're going to have a heart attack with a car crash, and you're going to hurt other people and yourself even more. So call 911 if you think you're having it. If you see somebody else, call 911, chew the aspirin, CPR if they pass out, and go from there. Oh, one thing with the aspirin, make sure you take note of the time and the amount of aspirin you give so the doctors can factor that into what medicines they give you. So that would be one thing. Take the note of the amount of aspirin you took and the time you took it. And I think that will do it for this section of the notes. Do you guys have anything else to add with signs, symptoms, and how to respond?
No, I mean, other than to point out again, this is all biology, all of this stuff we've been studying and talking about all year. I think this is one of those more tangible takeaways from this class. Now, hopefully you would never have to use this information as heart attack specific stuff, but leading a healthy lifestyle, that's biology. So here's hoping that this helps you or encourage you.